My name is Sanjeev Bhalla, and I'm a professor of radiology at Washington University, and I run the cardiothoracic imaging section here at the Mallinckrodt Institute of Radiology in St. Louis, Missouri. So mesothelioma is one of the cancers that it can be a really tricky one in terms of diagnosing and staging. I think in many centers, what really determines what's used is based on what's available. And so in our practice, we tend to use a lot of radiography to determine if there's a pleural effusion, and then CT is used almost immediately afterwards to determine what is the etiology of the pleural effusion and to see if there's any nodular enhancement. So important, I think, for providers to realize is that a CT with intravenous contrast is really indicated when mesothelioma is the question in terms of staging, because it allows us to look for pleural thickening and it allows us to look for subpleural extension. It's also really important, especially in this modern era, that CT be performed in a venous phase. So by that, I mean a 70-second delay or greater. I say that it's important because the pulmonary embolism protocol and the aortic dissection protocol have become ubiquitous in many practices, but these protocols don't really allow for adequate evaluation of serosal surfaces, and we've seen quite a few tumors of the pleura overlooked. So a patient may present to emergency department with chest pain, and it may be from a malignancy involving the pleura, but it's overlooked because the study that was performed was a PE protocol CT too early to figure out if there's enhancement of the pleura. So at our institution, we will usually begin with a contrast-enhanced CT in a portal venous phase or a 70-second delay to allow us to see if there's pleural nodularity and enhancement. It also allows us to look for lymphadenopathy in the chest. And then the question will become regarding extrathoracic extension or metastases. Oftentimes PET-CT is used, and that's a very good modality because we'll find that these mesotheliomas do have avid FDG uptake on FDG PET, and that can be used to help us look for lymph nodes or metastases outside of the thorax. Occasionally, we'll do an abdominal pelvic CT as well. In my opinion, one modality that's underused for the evaluation of mesothelioma is chest MRI. But to use it effectively, you have to be aware of the expertise of the people performing the MRI. There must be a group that has an interest in thoracic MR. And so, if so, protocols will be used to optimize. And so at our institution, we don't tend to use it quite frequently, but when the question becomes whether a patient is a candidate for an extrapleural pneumonectomy in the setting of mesothelioma, we may end up doing an MRI in order to evaluate for mediastinal extension and chest wall extension, factors that may affect the surgical approach to the disease.